if you had to pick between a stroke or a heart attack, which one would you rather have? Now, of course, you wouldn't want either, but if you had to pick one, which one would you rather have? But go ahead and tell me in the comments down below. I'm very curious. A stroke is basically either a clot or plaquing that has dislodged somewhere in your body, either in the carotid arteries through here or the heart, and it's gone up into your brain and it's stopping blood flow. Now, with a heart attack, we have a clot or a plaquing that's stopping blood flow in the heart muscle. So in reality, a stroke and a heart attack is really the exact same thing, but in different locations in the body. Now, for me, I would much rather have a heart attack than a stroke, because having half of your body being paralyzed and then having your spouse drag you around, clean you, bathe you, take you everywhere, oh my gosh, that would be such a burden on your spouse. And to be trapped in a body where half of your body is non-functional would be literally torture. Now, with a heart attack, which has a 12% mortality versus a stroke, which has a 28% mortality, we have become really good at keeping people alive. So when people have a heart attack, there's really great emergency care that can recover a person. But the number one cause of death is a heart attack. And with a stroke, that's the 5th cause of death. Now, they use this acronym for a stroke. So F would be your face is drooping on one side, you're losing muscle control. And A would stand for your arm on one side being weak or even paralyzed. And then we have S for speech difficulty. You're slurring, you can't really articulate as well. And then you have T for time. There's no time for waste. If someone has a stroke, you want to call 911, get them into the hospital so they can quickly give you a certain medication to dissolve the clot. Usually you have up to 6 hours, but the sooner the better. Now, what's really bizarre about a heart attack is 48% of the US population has a heart problem, and many times they don't even know it. All right, so you can get all these tests done and you can get your arteries scoped, and you should get a test called the CAC. Stands for coronary artery calcification test or scan. It's a quick test to measure how much calcium is in the artery, and it's one of the best predictors of heart attacks. And obviously, if there's calcium, there's plaquing, and some of that plaque can get dislodged and travel up to your brain. But the underlying mechanism, the root cause for both of these problems is exactly the same, because they both originate in the heart. Well, sometimes a stroke can originate from problems in your carotid arteries in your neck through here. But most of the time, it actually comes from your heart. You have this piece of plaque that dislodges from the heart, goes up to the brain. So the mechanism is this. You have inflammation in the inside of your arteries, which is then creating a compensatory or compensating reaction where your body is going to try to heal with a Band-Aid. The body's Band-Aid is calcium, cholesterol, and certain proteins like fibrous tissue. And that inflammation, if you've been watching my videos, is either coming from the overconsumption of the bad carbs, refined carbohydrates and sugar, or too many omega-6 fatty acids, which is in pretty much all the foods, like the soy oil, the corn oil, the canola oil, which is in the majority of your salad dressing and deep fried foods. And the list goes on and on and on. And of course, we switched over to these omega-6 fatty acids because we thought that saturated fats were bad for you, when in fact, they are not bad for you as long as you keep your carbs low. Now, let's say, for example, you don't want to go get a test and you want other clues to know if you have inflammation in your arteries. Number one, just do this right now. Stand up and look down at your toes. If you happen to see something obstructing your view called your belly, okay, your belly sticking out, chances are you have inflammation in your arteries, because belly fat is a symptom of too much insulin and too much blood glucose. And both of those are like steel wool or sandpaper for the inside of your arteries. Number two, look in the mirror at your face. Do you have a swollen face? Look around the eyes. Are they puffy? Are your cheeks puffy? Do you have fat in your neck? It's a really good indication that you have too much insulin, too much blood glucose, and that means that your arteries are also inflamed. All right, number 3, are you a carbo junkie? Do you crave carbs? Do you eat chips late at night? Do you always have to have a dessert? Do you always have the fries when you order a hamburger? Do you basically do carbs? If you do, chances are you have inflammation in the arteries. Now, there are 3 things I'm going to recommend. Number 1, I'm going to recommend you get some vitamin E immediately. The type of vitamin E you need to get is called tocotrienols, okay? Take about 300 milligrams every single day, and that's going to help reduce the oxidation or the free radicals that's going on in the inside of your arteries. Vitamin E is the absolute best nutrient for the heart. Number 2, you want to lower your carbs, okay? That's called the ketogenic plan. And number 3, and this is actually just as important as number 2, you want to do intermittent fasting. You want to stop the snacking. You want to skip your breakfast, because that will instantly lower the amount of insulin that's being pumped through your body, which I bet anything you've never had that tested. There's a great test to do. It's called HOMA-IR, and they usually are focused on the blood sugars, but they don't check the fasting insulin, which is usually high way before you have high blood glucose. In fact, it's the thing in the background that's pushing your blood sugars down. So when you get your blood sugars checked, they appear to be normal, which in fact, the only reason that they're normal is because the insulin is so high, pushing your blood sugar down. So anyway, comment down below and tell me which condition you would rather have if you're forced to have either. So if you're enjoying my content, which I hope you are, and you're applying this knowledge to your health, and you have a success, I would really appreciate you sharing your success story. So click the link down below to my website where you can upload your success story so you can help inspire others.